Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Thompson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Thompson. How are you today?
Morning, doctor. I'm all right, but something's been bothering me, so I thought I should get it checked out.
I see. What seems to be the issue?
Well, for the past couple of weeks, I've been feeling really tired. Like, more than usual. It's not the normal kind of tired, it feels deeper, like my whole body's drained. And I've had this weird rash on my leg. It started as a small red spot but then grew into this larger circular shape. A friend of mine said it looked like a bullseye, so I figured I'd better see someone about it.
That's interesting. You said it started a few weeks ago. Can you remember anything that happened around that time? Any outdoor activities or insect bites?
Actually, yeah. I went camping with some friends about 3 weeks ago. We were hiking and spent a lot of time in the woods. I did get bitten by something, but I didn't think much of it at the time. It just looked like a mosquito bite at first.
Okay, that's helpful to know. Based on what you've told me, especially the fatigue, the rash, and the bite, there's a possibility this could be related to Lyme disease. Have you heard of that before?
Yeah, I've heard of it, but I don't really know much about it. Isn't it caused by ticks?
Yes, that's correct. Lyme disease is transmitted through the bite of infected black-legged ticks, also known as deer ticks. Not everyone who gets bitten by a tick develops Lyme disease, but if the tick carries the bacteria, it can cause an infection. The symptoms you've described, the bullseye rash and the fatigue, are classic signs. Have you had any other symptoms like headaches, joint pain, or a fever?
Now that you mention it, I have had some muscle aches. At first, I thought it was just from the hiking, but they haven't gone away. No fever, though.
Muscle aches are another common symptom. It's good that you came in when you did because early detection is key. If Lyme disease is left untreated, it can lead to more serious complications, affecting your joints, heart, and even your nervous system.
That sounds serious. What should I do now?
First, I'd like to run some tests to confirm if it's Lyme disease. We can do a blood test to check for antibodies to the bacteria. If the test comes back positive, we'll start you on a course of antibiotics, which is the standard treatment. The sooner we start, the better the outcome. Antibiotics are typically very effective, especially in the early stages.
How long does the treatment take?
Usually, the course lasts for about 2 to 4 weeks. Most people start to feel better after a few days of treatment, but it's important to finish the full course to make sure the infection is completely cleared.
Is there anything I should do in the meantime?
Rest is important, especially since fatigue is one of your main symptoms. Try to avoid strenuous activities for now. I also recommend staying hydrated and eating well to support your recovery. And keep an eye on the rash. If it changes or if you develop any new symptoms, let me know right away.
Will the rash go away on its own?
Yes, it should fade as the antibiotics start to work. The rash is a reaction to the infection, So as we treat the underlying cause, it will improve. If the rash becomes more painful, or if you notice any spreading though, don't hesitate to reach out.
That makes sense. What about preventing this in the future? Should I be worried about going outdoors again?
You don't need to avoid outdoor activities entirely, but it's a good idea to take precautions, especially if you're in areas where ticks are common. Wearing long sleeves, tucking your pants into your socks, and using insect repellent with DEET can help prevent tick bites. Also, checking your body for ticks after being outside is important. They're tiny, but they can attach to your skin, so a full body check is always a good habit.
I'll definitely be more careful next time. How likely is it to get Lyme disease again?
It's possible to get Lyme disease more than once if you're bitten by another infected tick, but if you're aware of the risks and take the right precautions, you can reduce your chances significantly.
That's good to know. I'm glad I came in. I didn't think much of it at first, but now I realize it could have gotten a lot worse.
Yes, it's always better to err on the side of caution when it comes to something like this. We'll get those tests done today and move forward from there. You should expect results within a few days, and I'll contact you as soon as they're in.
Sounds good. Thanks, Doctor.
You're welcome, Mr. Thompson. Take care, and I'll be in touch soon.
Extract 2, questions 13 to 24. You hear a gastroenterologist talking to a patient called Mr. Harrison. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Harrison. How are you feeling today?
Afternoon, doctor. Well, to be honest, not great. My GP referred me to you because I've been having some issues with swallowing. It's been getting worse over the past few months.
I see. Can you describe the symptoms you're experiencing in more detail?
Sure. It started off as just a slight discomfort when I was eating, like the food was getting stuck in my throat or chest. At first, it was only with solid foods, but now it happens with liquids too. Sometimes I have to force myself to swallow again, and it feels like the food finally goes down, but it's really uncomfortable.
That sounds very frustrating. Have you noticed anything else, such as heartburn or regurgitation of food?
Yes, actually. I do get heartburn occasionally, but it's the regurgitation that's really bothering me. It's like the food comes back up after I eat, especially if I lie down too soon afterward. I've also started losing some weight because I'm avoiding eating as much as I used to. Eating has become more of a chore than something I enjoy.
I understand. Have you tried any treatments or remedies so far?
I've tried a few things. I switched to eating smaller meals more frequently throughout the day, and I avoid eating late at night. I've also tried drinking more water with my meals, but it hasn't really helped. I even cut out spicy foods and caffeine, thinking it might be acid reflux, but nothing's changed. My GP suggested trying a proton pump inhibitor, but that didn't make much of a difference either.
Thank you for sharing that. It sounds like you've been proactive in trying to manage this on your own. Based on what you've described, it's possible that you might be dealing with a condition called achalasia. It's a rare disorder that affects the esophagus, making it difficult for food and liquids to pass into the stomach because the muscles at the lower end of the esophagus don't relax properly.
Achalasia? I've never heard of that before. Is it serious?
It's understandable that you haven't heard of it. Achalasia is not very common. It can be serious if left untreated, but there are effective treatments available. The exact cause of achalasia isn't well understood, but it's thought to involve damage to the nerves in the esophagus. The most common symptoms are exactly what you've described: difficulty swallowing, regurgitation, and sometimes chest pain.
That sounds exactly like what I've been going through. What kind of treatments are available?
There are several options, depending on the severity of your symptoms and your overall health. One option is pneumatic dilation, where a balloon is used to stretch the lower esophageal sphincter. Another approach is a surgical procedure called a helomyotomy, where the muscles at the lower end of the esophagus are cut to allow food to pass more easily. There's also a less invasive treatment called pleural endoscopic myotomy, or POEM, which is similar to the helomyotomy, but is done using an endoscope. Medications like calcium channel blockers or nitrates can sometimes be used to relax the lower esophageal sphincter, but they are generally less effective for long-term management.
Those sound like serious treatments. Are they effective?
Yes, they can be very effective. The goal is to relieve your symptoms and improve your quality of life. The choice of treatment depends on various factors, including your age, overall health, and the severity of your condition. We would discuss the options in more detail after confirming the diagnosis. This usually involves tests like an esophageal manometry, which measures the pressure inside your esophagus, or an upper endoscopy to look at the esophagus directly.
It sounds like I have a lot to think about, but if it helps me get back to eating normally, I'm willing to do whatever it takes.
That's a good attitude to have. Achalasia can be challenging, but with the right treatment, most people experience significant improvement. We'll make sure to find the best approach for you. The first step is to confirm the diagnosis, and then we can discuss your treatment options in more detail.
Thanks, doctor. I appreciate your help. It's been a real relief just to talk about it with someone who understands.
You're welcome, Mr. Harrison. We are here to help you. Let's take things one step at a time and get you back to enjoying your meals again. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking to a patient who has just been diagnosed with high blood pressure. Now read the question.
So, we've gone through your results, and it looks like your blood pressure is a bit higher than we'd like. How are you feeling about that?
I'm a bit surprised, to be honest. I didn't think it would be an issue. I mean, I don't feel any different, no headaches or anything like that.
That's common. High blood pressure often doesn't have obvious symptoms. But it's important we manage it to avoid complications.
I'm worried about taking medication. Will I have to be on it for the rest of my life?
Not necessarily. With some lifestyle changes, we might be able to manage it without medication, or reduce the dose over time.
I'll try, but I'm still a bit nervous about what this means for my health long term.
It's understandable, but we'll work together to keep everything under control.
Now look at question 26. You hear a doctor talking to a nurse about a patient. Now read the question.
Last time she was here, she mentioned that lying down in a dark, quiet room with some anti-nausea medication really helped. But right now, she's in a lot of discomfort and is having trouble relaxing enough to do that.
I see. Given her history and current symptoms, do you think we should start with some IV fluids and anti-nausea medication to help manage her condition?
Yes, I think that's the best approach. We can start with the fluids to keep her hydrated, and the anti-nausea medication should help alleviate some of her symptoms. Once she feels well enough to rest, we can reassess her condition and see if she's comfortable enough to stay in a quiet room.
Agreed. We'll monitor her closely to ensure the treatment is effective and adjust as needed. Let's get her started on the IV and medication right away.
Now look at question 27. You hear a nurse and a patient discussing the administration of an insulin injection. Now, read the question.
Let's go over the steps for your insulin injection. What's the first thing you should do?
I need to wash my hands thoroughly and clean the injection site with an alcohol swab. After that, I'll prepare the insulin by gently rolling the vial between my hands to mix it evenly.
Excellent. And when it comes to the needle, what's important to remember?
I should always use a new needle for each injection and make sure to inject at a 90-degree angle. I'm just a bit unsure. How long should I hold the needle in place after injecting?
You should hold the needle in place for 5 to 10 seconds to ensure that all the insulin is delivered into your body. And once you've completed the injection, what's the next step?
I need to dispose of the used needle safely in a sharps container and then monitor my blood sugar levels to ensure everything is within the target range.
Now look at question 28. You hear a medical professional explaining about electronic health record. Now read the question.
Now, you'll have received the proposal regarding the introduction of new electronic health record, EHR systems, and I'm sure you've got your own thoughts about how this might affect your day-to-day responsibilities. You're probably aware of the evidence suggesting that EHRs can significantly improve patient care by providing quick access to patient history and reducing errors. There's no doubt about the potential benefits here, but we understand that you might be concerned about the learning curve and additional time needed to adapt to the new system. That's why we've ensured that the transition will be as smooth as possible. Comprehensive training sessions will be provided, and technical support will be available around the clock to assist with any issues. We've also scheduled the rollout in phases to allow you to adjust gradually, without overwhelming you or disrupting your routine. Managers will be closely monitoring the process to address any concerns as they arise.
Now look at question 29. You overhear two clinic coordinators discussing patient follow-up for a new wellness program. Now read the question.
We've only managed to follow up with about 35% of the patients who signed up for the wellness programs so far. It's concerning because we're way behind on our target.
Less than a third of the patients, and the program requires us to complete follow-ups with all of them by the end of next week. Should we consider sending out another batch of reminder letters to get their attention?
We've already sent 3 rounds of reminder letters. I've even tried calling several patients personally to ensure they're aware, but the response rate is still low. I think we need to address this during our next clinic team huddle to figure out a different approach.
That's scheduled for Monday morning, right? Do you think that timing will work for everyone on the team, or should we consider another time?
It should work since the team huddle is already on everyone's calendar, but if anyone can't make it, we can arrange a brief individual meeting with them to ensure they're updated.
Now look at question 30. You hear a dietitian talking to a patient who's just been diagnosed with type 2 diabetes. Now, read the question.
It seems your blood sugar levels are higher than normal. How are you feeling about making some dietary changes?
I'm a bit overwhelmed. I didn't expect this. I mean, I don't usually eat a lot of sweets or anything.
That's understandable. Diabetes can be surprising, And it's not just about sugar intake. It's important to focus on overall healthy eating to manage it. We'll look at the types of carbohydrates you're eating, portion sizes, and meal timing to help keep your blood sugar stable.
I'm concerned about giving up the foods I love. Will I have to cut them out completely?
Not necessarily. We'll work on creating a balanced meal plan that includes your favorite foods in moderation. It's about finding healthier alternatives and portion sizes that fit within your new lifestyle, so you can still enjoy what you love while managing your blood sugar levels.
I'll do my best, but I'm still anxious about maintaining this long term.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a conversation between a journalist and Dr. Sarah Reynolds discussing childhood asthma. You now have 90 seconds to read questions.
We're here today with Dr. Sarah Reynolds, a pediatrician with a special focus on childhood asthma. Dr. Reynolds, could you start by explaining what childhood asthma is and how you developed such a keen interest in this area?
Childhood asthma is a chronic respiratory condition where the airways in the lungs become inflamed and narrowed, making it difficult for children to breathe. Symptoms often include wheezing, coughing, and shortness of breath, especially during physical activity or at night. My interest in childhood asthma grew gradually over my 20-year career as a pediatrician. I've seen so many children struggling with this condition, and their experiences deeply moved me. But my passion for this subject really intensified when my own son was diagnosed with asthma at the age of 3. Seeing his daily struggles and the impact it had on our family brought the issue much closer to home. It made me want to help other families navigate this difficult journey.
What would you say is the most challenging part for families dealing with childhood asthma?
One of the biggest challenges is the unpredictability of asthma attacks. Families live with the constant anxiety that an attack could happen at any time, especially in cases where the child has severe asthma. Take, for instance, one of my patients, Emma. She's 7 years old and has had asthma since she was a toddler. Her parents describe the fear they feel whenever she has an asthma attack. It's like watching your child struggle to breathe while you feel powerless. This unpredictability can disrupt the entire family's life, from missed school days to sleepless nights and even financial strain due to medical costs. It's not just the physical symptoms, it's the emotional toll that really weighs on families.
How do children like Emma cope with the limitations that asthma imposes on their daily lives?
For many children, the hardest part is feeling different from their peers. Emma, for example, loves to play soccer, but she often has to sit on the sidelines when her asthma flares up. This makes her feel left out and frustrated because she wants to be just as active as her friends. Over time, this can lead to feelings of isolation and even depression. Some children also experience anxiety, constantly worrying about when their next asthma attack will occur. These emotional aspects are often overlooked, but they're just as important as managing the physical symptoms of asthma.
What support is available for children with asthma and their families?
There are various resources, such as asthma education programs that teach families how to manage the condition effectively. These programs cover everything from recognizing early signs of an asthma attack to using inhalers correctly. I've also found that peer support groups can be incredibly valuable. In these groups, families can share their experiences, which helps them feel less alone in their struggles. But what I've noticed is that the medical community sometimes falls short in addressing the full spectrum of needs that these families have. We focus a lot on the physical management of asthma, but sometimes neglect the emotional and psychological support that is so crucial.
Can you tell us about any changes you've made in how you approach treating your patients with asthma?
Certainly. One change I've implemented is dedicating more time during consultations to discuss not just the physical, but also the emotional well-being of the child and their family. I had a patient, Ethan, who is 9 years old and has severe asthma. He was struggling with anxiety, constantly worrying about having an asthma attack at school. I realized that while we were managing his asthma symptoms well, we weren't addressing his anxiety. So I started including a brief counseling session during his regular checkups. This allowed Ethan and his parents to talk about their fears and frustrations, which in turn helped to alleviate some of the emotional burden they were carrying. This approach has made a significant difference in Ethan's overall well-being, and I've adopted it for all my asthma patients.
What can be done to prevent asthma attacks in children, particularly in those who are at high risk?
Prevention is key, and it starts with identifying and avoiding triggers that can provoke an asthma attack, such as allergens, smoke, and cold air. But it's not just about avoiding triggers, it's also about ensuring that children with asthma have an action plan in place. This includes having quick access to medications, knowing how to use them properly, and recognizing the early signs of an asthma flare-up. Early intervention can prevent a minor episode from turning into a full-blown attack. Education is crucial here, both for the child and the family. The more they know about managing asthma, the better they can prevent severe episodes. I always tell my patients and their parents that they should never hesitate to seek medical advice if they notice any changes in symptoms. Asthma is a condition that needs constant vigilance, and with the right knowledge and tools, it can be managed effectively.
Thank you, Dr. Reynolds, for sharing your insights with us today.
Extract 2. Questions 37 to 42. You hear a doctor giving a detailed presentation on smoking cessation. Now, read the questions. You now have 90 seconds to read questions.
My name's Dr. James Turner, and I'm a pulmonologist working here in the hospital. Today, I'll be addressing a topic that many find challenging, discussing smoking cessation with patients who are smokers. Smoking is a deeply ingrained habit for many, often tied to emotional and social factors. Patients can feel defensive, judged, or even hopeless when the topic of quitting is raised. As a healthcare provider, I encounter this regularly, yet initiating conversations about smoking cessation can still be daunting for both myself and the patient, who may already anticipate the discussion. This difficulty arises because, as healthcare providers, we're often unsure of how to broach the subject of smoking while ensuring we remain supportive, non-judgmental, and empathetic. In our consultations, we aim to deliver our message effectively, but without the proper training and approach, there's a risk of eroding trust and damaging the critical provider-patient relationship. We might unintentionally stigmatize or shame our patients, which can undermine the treatment goals and, ultimately, the patient's health outcomes. So how can we communicate effectively on such a sensitive matter? Often, the words we choose as we open the dialogue with the patient are the most impactful. Establishing a patient's comfort level with discussing their smoking habits is crucial. Asking them directly if they're open to talking about their smoking and its impact on their health is an efficient way to gauge their readiness for the conversation. Once the discussion is underway, I found it helpful to use terms like tobacco use instead of smoking addiction or cutting back instead of quitting cold turkey. These phrases are often less confrontational and help in building rapport with the patient. One approach that I've found particularly effective is focusing on the habit rather than labeling the patient. For instance, instead of saying, "You're a smoker," I prefer to say, "You have a history of smoking." This shift in language can make a significant difference in how the patient perceives the conversation. Similarly, using open-ended questions, carefully articulated without any implicit assumptions or biases about smoking, can prevent the patient from feeling judged. Let me provide an example. Pulmonologists often inquire about a patient's smoking history, their triggers for smoking, and any past attempts to quit. If I say, "You need to quit smoking," it comes across as a directive, a judgment. However, if I ask, "Have you considered cutting back on smoking?" it suggests that I'm aware of the challenges they've faced and that I'm here to support them, allowing the patient to engage in the conversation without feeling pressured or criticized. Of course, there are times when, despite our best efforts, the conversation doesn't go as planned. In such cases, I believe it's essential to relate the patient's smoking habit to their current health issues, whether it's chronic obstructive pulmonary disease, COPD, cardiovascular disease, or another smoking-related condition. Regardless of the specific condition, the overall health of the patient is the priority. When done tactfully, linking smoking to their current health problems can be highly persuasive, as it helps the patient see smoking as a factor that exacerbates their condition. When they understand that reducing or quitting smoking might alleviate their symptoms, the effort required to change their behavior can seem more manageable. Providing ongoing education and support reinforces the advice and recommendations given during the consultation. This can be as simple as offering patient brochures on the benefits of smoking cessation, nicotine replacement therapies, and local support groups. I personally recommend setting 2 or 3 realistic, measurable goals for smoking reduction or cessation and discussing the steps needed to achieve them. This is also an excellent opportunity for the healthcare provider to assess the patient's readiness for change, as well as the level of support they have from family and friends, which can be a crucial factor in their success. Everything I've discussed here today is an example of what healthcare providers refer to as motivational interviewing. This technique is an open-ended style of communication designed to help patients move from being ambivalent about change to taking steps toward making positive lifestyle changes.
That is the end of Part C. You now have 2 minutes to check your answers.